this is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. In this edition of the Migration Health Research Bulletin, issue number 17, we profile a number of books and book chapters on the following topics: COVID-19 outbreak preparedness and response in refugee camps, gender-based violence in emergency settings, health system strengthenings at the borders, and health assessments among forced migrants. We also feature studies on the elimination of tuberculosis and female genital mutilation among migrants, as well as Ebola outbreak response. For this audio podcast episode, we are pleased to feature two studies. Dr. Francis Mulekya, Migration Health Coordinator based in IOM Pretoria, will talk about the stories of change and best practices pertaining to sexual and reproductive health rights in Africa. And Dr. Aiko Kaji, Migration Health Project Development and Implementation Officer based in IOM Hanoi, will speak about the migrant health status in Viet Nam. Let's listen to Dr. Francis Mulekya.
The primary objective of the study was to document emerging stories of change and best practices from selected project sites in the 6 countries where we operate, and this would help to contribute to knowledge sharing and project learning, but also to share internally within the project team and externally with partners and key stakeholders. The methodology employed was basically review of secondary data and collection of primary data using focus group discussions and key format interviews with the project beneficiaries and key stakeholders in the 6 project countries. A final validation workshop of the findings was held with the project team and stakeholders, but also we employed a gender-sensitive approach to allow for a gender analysis be integrated into the best practices and stories of change compilation.
What were the key findings from this study that you want to highlight?
First, the stories of change demonstrate that the project is having important outcomes and impacts within the implementation sites across the 6 countries. The stories of change further highlight how the project interventions have provided sexual and reproductive health and HIV knowledge and support in increasing access to services for the migrant, sex workers, and the young people who are the main beneficiaries of the project. For example, some stories illustrate how internal and cross-border migrants have received support from community-based change agents related to gender-based violence, access to HIV testing, antiretroviral treatment, as well as family planning. Other stories demonstrate how current work in some communities in terms of drama groups, especially led by the youth, the door-to-door health promotion activities, and the rollout of the comprehensive sexuality education in schools has an enabling environment for adolescents and young people to address their SRH and HIV needs. Another story highlights the way in which sex workers engaged in the project have been empowered to lead community-level responses to address identified SRH and HIV priorities in their own communities. Selected best practices unpack the project's approaches to engaging traditional and community leaders, as well as the faith-based leaders for support, partnership, and sustainability of the SRH interventions at the community level. 2, using multi-pronged approaches to improve SRH, HIV outcomes amongst sex workers. And 3, improving community referrals and referral completion rates for SRH and HIV services among the target population. And lastly, we've witnessed a progressive improvement in an enabling environment for improved SRH and HIV outcomes through regional and policy-level engagement and advocacy.
Given these findings, what are the implications of the study findings for policy or program? What are your recommendations?
The stories of change and best practices demonstrate that the elements of the project approach are indeed working in tandem to contribute to every real changes in the lives of the migrants, the sex workers, and the young people, as well as the host communities. Work at these different levels has allowed the project to work through both bottom-up and top-down interventions to advance access to services and the realization of the rights of migrant sex workers and young people, along with others in migration-affected communities. Going forward, we think that these best practices will need to be modeled and replicated in other areas within the SADC countries, as they have shown to be effective in reaching out the most marginalized populations, that is the migrants, the sex workers, and the vulnerable young people in migration-affected communities.
Now, let's listen to Dr. Aiko Kaji.
This study aimed to identify migrant health needs, gaps, and priority for future planning in Vietnam. Let me explain the background of the study briefly. Vietnam has a long history of population movements. The recent census showed about 35% of the country population lived in urban areas. Many of them are internal migrants. Vietnam is also a migrant-sending country. More than 120,000 Vietnamese migrants are currently working under fixed-term contracts in overseas countries, territories as destinations. A relationship between health and migration is complex and influenced by the socio-economic and cultural backgrounds of migrants, their previous health histories, as well as the nature, quality, and access to healthcare systems prior to moving. At the regional and global level, ensuring the health of migrants is a common responsibility with public health impacts that extend beyond national boundaries. Global health security, for instance, requires collective efforts across countries, as we see today emerging infectious diseases such as COVID-19, Ebola, and Zika threaten the international communities. The Ministry of Health Vietnam was the principal investigator of the study, as the government of Vietnam has recognized the importance of migrant health and committed to implementing resolutions promoting the health of refugees and migrants, which was endorsed by the World Health Assembly in May 2017. That is the reason why Ministry of Health, IOM, WHO jointly undertook the situation analysis of migrant health to assess the current situation of migration, health and healthcare needs of migrants and their challenges for future planning in Vietnam.
What do you think are the key findings from this study and their implications for a policy or a program?
The research identified key factors that impact on health of migrants and their ability to access healthcare, including fragmented policy implementation at the local level, insufficient migrant health monitoring systems, lack of effective partnerships and networks between stakeholders, limited migrant and gender sensitivity among healthcare professionals, administrative officers, and broader society. These key factors we found in the study are interconnected. Ministry of Health alone cannot address complex issues. To address these interconnected issues comprehensively, we need intersectoral collaboration in the country. In the report, we have proposed action points, as these recommendations will contribute to developing an action plan for migrant health in Vietnam. I just would like to emphasize important considerations such as potential impact of interventions, resource requirements, implication for health and welfare systems, cost effectiveness for each proposed action must be accessed through extensive stakeholder consultations facilitated by, for instance, Intersectoral Committee on Migration Health. Vietnam, we can apply a similar intersectoral approach taken by other countries such as the Philippines and Sri Lanka. Again, migration health is complex, very complex. Ministry of Health alone cannot address complex issues. Establishing such as interministerial working group or committee will help the country of Vietnam facilitate the design and implement more migrant-friendly policies, and collaboration across Department of Ministry of Health and the other ministries through taking intersectoral action is very important for advancing the migrant health agenda in Vietnam.
Thank you very much, Dr. Francis and Dr. Aiko. And thank you all for listening. Please feel free to share feedback with us. See you on the next podcast.